Dr. Jamila Koshi is a consultant psychiatrist at Bangalore Baptist Hospital and Philomena's Hospital in Bangalore. She did her MBBS from AFMC Pune and diploma in psychiatry from Lokmanya Tilak Municipal Medical College, Mumbai. And Dr. Jamila has worked in the Armed Forces Medical Corps and in civilian hospitals and has also been in private practice in several cities in India. She enjoys teaching and writing on mental health issues and also helps NGOs. If you Google her, you can find very interesting videos on YouTube. So once after this session, please go ahead and listen to them. Thank you so much, Dr. Jamila, for making time for us. Over to you, Dr. Indu.
Thank you so much, Dr. Vidya, for very detailed introduction. I thank Marvelous Medicine and you for giving me this opportunity to interact with all of you and having very senior people as audience and as also my moderator of this session. And I also congratulate you for taking up this topic of conflict resolution, because I think we are experiencing a lot of conflicts in healthcare. Whether we like it or not, I think people who were very, comfortable with us, and we were very happy having them on our side. But today, I think we are also in conflict with them. I'm talking about patients. I'm talking about other stakeholders in healthcare, and it's time that we sit and understand what is conflict, what are different conflict resolution, styles people have, and what will work in healthcare, and also the common causes of conflict. If we know the cause, I think probably we can more mindfully handle and prevent those situations from happening. So all in all, my session will be giving an idea about what conflict is, although I'm sure all of us know what conflict is, but we'll look at it from the healthcare point of view, because ultimately conflicts in healthcare are very typical to healthcare, and it's time that we learn to go about handling them. And actually, conflict resolution is a very very much in demand, because now not only in healthcare, I think in all spheres of life, we are all experiencing conflicts, and it's a very sought after kind of a skill. And sooner we acquire this, I think better we will be. So before I go and start with my presentation, I just want to ask members who are here, what do you think? What is conflict? Would you like to write in the chat box, because it would be possible to unmute? So would you like to write what do you understand by the term conflict? What is conflict? Absolutely, a difference, a clash of opinion. Very true, agreed. Yeah. Then difference of opinion, very disagreement. Yes, differences in ideas, disagreement, differing viewpoint, differing expectations, and serious difference of opinion not managed with discussion. Opposite views, absolutely. Attitudes, especially if they are counter and they are against each other, absolutely. Disagreement. So I can see all of us have quite a fair idea about that conflict is kind of a disagreement between two people or two ideas, or it could be even between two groups of people. So you have mentioned about soft versus hard approach. So that means how people handle situations. There can be a conflict of approach, and that can also lead to conflict. Absolutely. Now, my second question to all of you is, are all conflicts bad? Are all conflicts bad? No. I think we know that not all conflicts are bad. So there are functional conflicts and there are dysfunctional conflicts. So some conflicts are actually productive because they help us, work on a situation and find solutions creatively. But of course, there are, dysfunctional conflicts which we experience more often, where we are not able to move further and not find a solution, and then we are just waiting for something to happen which doesn't actually happen on its own. So definitely, I think some conflicts are definitely healthy and they are functional. I can see some answers coming in the chat box. Some are healthy conflicts, and they help us find solution. But for conflict avoiders, all conflicts are successful. I completely agree with you, Dr. Ravi. Yes, people who avoid conflict, they assume that I won't be able to handle it, or probably it is a stressful situation, so they try to avoid handling that kind of a solution, that kind of a conflict. And no, two heads are better than one sometimes. Yes, especially if they look alike, if they see alike, if they think alike. But if they are not, on thinking on the same lines, then definitely that becomes a difficult task. So I think we have a fair idea that there are conflicts, and conflicts are part and parcel of life. I think that's one acceptance we need to have. If I think that there should be no conflict, it's actually impossible. There will always be conflict. If you look at home with our own spouses, with our family members, with our children, we all experience some amount of conflict when we don't agree or we don't, understand each other's point of view. But at home, I think we are more quick and proactive in managing conflicts. But incidentally, when conflicts happen at workplace, rather than working on resolving the conflicts, a lot of time we accept them as part of life, and then we just maintain that conflict and then work around it. But we don't try to resolve the conflict. And I think that's where we really need to work, because ultimately we spend almost half of our life at workplace, and we don't only carry money from our workplace, we carry energy, we carry happiness, we carry satisfaction. And if we are experiencing a lot of conflict at workplace, ultimately it affects our mental and physical health, and definitely it affects our personal life, where we carry the burden with us. And then sometimes there's a transfer of anger and transfer of stress, and all sorts of things happen in our personal life also. So very mindfully we have to ensure that the workplace environment where we are living, we have to mindfully make it positive and also constructive and meaningful for all of us. And therefore, I think this approach of resolving conflicts is very important. So let me share the screen and also show you the presentation that I have prepared for this program. So that will help us go deeper into the subject and also develop deeper understanding about the topic. So right here, first thing that I want to clarify, I think more than naming this as conflict resolution, I think it's better if we name it as conflict management. So as I said, conflicts are bound to happen. So probably you will not be able to completely resolve the conflict. But if we can bring it to a level where conflict uh, becomes functional, and also it doesn't interfere with our day-to-day functioning, even that is good enough. So we could actually replace the word conflict. Instead of conflict resolution, we could use conflict management. So as answered by all of you, conflict is nothing but incompatible goals, attitude, emotions, behavior, which actually lead to disagreement or opposition between two or more parties. So it's part and parcel of everyday life. It's not same as violence, but it is part and parcel of our life. And it is not just about that it exists, it is how we manage the conflict that decides what will be the outcome. So one has to first of all accept that conflicts are bound to happen, and we just have to learn to manage them and make them functional. So as I said, all conflicts are not bad. Some conflicts are functional. They are actually constructive because they bring two people together. It actually brings in more ideas, more thoughts, more options. When two or more people sit and work together, they may not agree initially, but when they have a dialogue, when they discuss, when they explore the opportunities, it actually improves the level of performance, because they come up with new ideas which might be which might be more useful than one idea coming from one person. So it leads to cross-functional problem solving and constructive change in the system. And that's a very beneficial point of functional conflict. But of course, there are dysfunctional conflict, which we all see very often around us. These dysfunctional conflicts actually are very disruptive in many ways, and they lead to a lot of wastage of time and resources. And we see this very often in a lot of workplaces, including healthcare, where people don't get along well, or they don't approve each other's point of view. They don't want to work together. There can be personality issue, there can be ego issue, there could be communication issue, there could be priorities issue, there could be resource issue. So a lot of these conflicts become dysfunctional, and they ultimately lead to a lot of wastage of time and resources. I think one we all have seen this, in our workplace. No, so here I want to ask, what are the different types of conflicts? What do you think? What different types of conflicts we have seen. So would you like to? I'm not asking for the examples of conflict. So what different kind of conflicts do we know of? I'm just trying to understand. Uh, okay, ideology. Yes, that's also one of the type of conflict that we see. People have different ideologies and they don't work together. Okay, financial conflict, yes. Monetary and financial both are same. Values, there can be difference in values, and that can lead to conflict in values, absolutely. Okay, okay. Religious and cultural beliefs, there can be difference in them, and that can work ethics, absolutely. Patient management techniques, people might differ on the patient management plan or strategies, absolutely. Method of work, yes, again there can be conflict around it. So if I put all these conflicts in rather two or three broad categories, I can say one type of conflict is intrapersonal conflict, that is within the individual. So it's usually in the mind. It is not with anybody. We are in conflict with self when there is a conflict between the two ideas or two thoughts. Then there is, of course, interpersonal conflicts. One which you have listed in the chat box is nothing but interpersonal conflict, where two or more people are in conflict with each other and there is a issue between them. We also see intergroup conflicts. Then two organizations, two big groups are in conflict with each other. We see even those kind of conflicts across the society. So for the purpose of benefit, I think we will focus on intrapersonal conflict and interpersonal conflict. So when we talk about intrapersonal conflict, these are the conflicts that are within an individual. So when there is a conflict of two or more ideas and all options look equally valuable. So there are options available and you are conflicted on what do I choose. So you find it difficult to select one of them. So it could lead to a conflict within the person. Or when we are doing something against our core values, core nature, or preferences, even there we might feel conflicted. So in nutshell, what I can say, when our mind, heart, and actions are not in sync, conflict is bound to. And that's usually part of our own conflict. I'm sure many of us experience that kind of conflict day in, day out. So, can you give some examples of intrapersonal conflict that we all experience? Please write in the chat box what kind of conflicts do you experience or have you seen for yourself or for others. uh, Ego, okay, so you want to be egoist or you don't want to be egoist, even that can be a conflict within the person. Okay, to deal with the issue or not, is a dilemmas can be a conflict, whether I address it or not, should I speak or not, should I express myself or not. Okay, to be secular or communal, of course that can also be a conflict. Wonderful. What more? Knowledge or have more. Okay, so when you feel that I have more knowledge or more, I know more than you, that can be a conflict. Treatment options for two things, yes, there can be a dilemma. What modality will work here? Is it worth my time? That can also be a conflict. Wonderful. I think I'm getting wonderful experience. Ideas coming from you. Whether to address the problem or not, that can be a conflict. I don't agree, but have to follow due to authority. Yes, I think that's a very common conflict when we have an order or a we have an order from a senior person or somebody who's in authority. We don't agree with that, but we have no choice. But we want to, we have to go on. So that can definitely be a internal conflict for the person. And then choosing between two things, obviously we would have it. So always my word first. So in case if somebody is in habit of always saying that what I say is the final word, and if their word is not accepted, it can also be a conflict for the person. So financial settled people are on arrogancy side, even if we are on normal term. Yes, that can be because especially if their communication style or behavioral style is aggressive, definitely it can be a conflict. So some of the conflicts, of course, you have mentioned a lot of examples. So some examples that I have mentioned in the presentation is a lot of time we have conflict between career and personal life. So we want to pursue career, but we have some personal responsibilities and we don't know what to prefer, especially when we have some family responsibility, elderly parent, or children at home, or other responsibilities. So one might feel that what do I choose between the two? Then there can be conflict over fear of failure and desire for success. We all want to experience success, but there is always a risk of failure. So we don't know whether should we really be taking risk and trying for it, or should we just be okay with whatever we have. Then, of course, conformity versus individuality. Like one of you have mentioned that you received some instructions from your senior and you got to really confirm with them, or you got to listen to them, or also there are social norms that you need to conform to. There are some professional norms that you need to conform to, but individually you don't agree with it. So it can be a internal conflict for a person. People who are people pleasing and who look after others at the cost of self-care. So I'm sure there will be a conflict that what am I doing? I'm not looking after myself. I'm not looking after my family, but I'm trying to please other and look after other. That also can be a conflict. Then past versus present can be a conflict. I mean, somebody has a traumatic past or some difficult past. So, settling in the present can be a conflict for a person. Letting go of the past can be a challenge. Ideal self versus real self. We all have a real self, but we also aspire for an ideal self. So if there's a huge gap between the two, this itself can be a big conflict, reason of conflict for a person. Then, of course, there are okay, so there can be ethical dilemmas that one might experience. Then risk taking versus safety. We all like to be safe. We all like to work safely. But then we also know growth lies when you go out of your comfort zone. So should I really be going out of my comfort zone? Should I really be trying something that's not, that has never been charted? So there's a dilemma. Should I really be going for that? Stability versus changes. So we all like to be, in our comfort zone and enjoy stability, but then it requires to grow, it requires to go out of your comfort zone and then also move forward. So again, there can be a conflict, and there can be number of factors actually which could be conflicting you, maybe personal responsibility, family responsibility, in the or other issues of life. Then of course, in the independence versus interdependence. So we all know that interdependence is something that's the need of the hour, because we work together as a team. But at the same time, some people really value independence. They like to do things on their own. So that itself can be a a conflict for somebody who are very fond of being independent. And even people who are interdependent, if they are asked to be independent, that itself can also be a reason for conflict for them. Then there are short-term gratification versus long-term goal. So somebody might get attracted to what gives them short-term gratification, but then they have a long-term goal which they find hard to pursue or accomplish. So that can also lead to kind of an internal conflict for a person. Besides these conflicts, there are specifically, for the healthcare professional, there can be role conflict. So when especially I'm talking about the doctors, when they are asked to play the role of an administrator, I see a lot of clinicians find it very difficult to accept that they have to, play the role of an administrator or take the responsibility of an administrator. I also see when we talk about quality implementation, quality improvement, or quality initiative, when we talk to clinicians, a lot of times they are not open to the idea, because they feel, I'm a clinician, I'm supposed to be doing my work, I'm supposed to be looking after patient. Quality implementation is not my need. I don't want to work on it. Just yesterday, I was talking to somebody about communication program for doctors, which I recently did for IMA Kerala. So somebody had called me inquiring about it. Then I said that it's a program for doctors. He said, I am in practice for 30 years. I don't need to learn communication. I'm a wonderful communicator. So see, the moment you say that you learn and you teach to others and practice, they say that we already know it. Then, I mean, when doctors are asked to do financial counseling for their patients, I see a lot of clinicians find it very difficult to do that part, and they want somebody else to pitch in or to take the responsibility. Then when they are asked to oversee day-to-day management of their department or OT or clinic, so they are not very happy doing it, because they think that's not my responsibility. Then by virtue of their position in the system, they are supposed to be the leader of their system. So when they are asked to, perform some personal management duties or to, supervise day-to-day functioning, they find it very difficult to take that. So By being in the position, they need to address the issues, they need to resolve the issues, they need to work on creating good work environment. So at times that becomes very difficult for them, which they find very hard to go beyond their clinical responsibility or their clinical job. Besides role conflicts, you will also see people experiencing value conflicts. Why is this slide not moving? Give me 1 second. Sorry. Yeah. Page, why is it stuck up? Okay, so as I said, besides role conflicts, a person might even experience value conflicts. I'm sure many of you may have experienced something like conflict of interest, especially where your personal interest and professional duties are in conflict with each other. So there can be a conflict of interest. Then professional integrity versus institutional pressure. We all know that certain institutions pressurize for performing, outperforming, meeting targets. So that would lead to a challenge to their professional integrity, and people might find it difficult to cope up with that kind of a pressure. Then work-life balance, I think it's a problem for most of the professionals because they find it hard to balance between the two. Initially, their priorities are work and career, and then after a while, when they realize that they haven't looked after their life and they need to, get back to their life, they've already committed so much that they find it very difficult to balance between the two. Patient autonomy versus paternalism, where sometimes we want to, respect patient autonomy and we want autonomy and we want the patient to take charge of their life. But patients, they expect the doctors to take the role of a parent and then, decide on their behalf. Or it could be the other way around, where we like to play the role of a parent for the patient and we like to practice paternalism. But the patient asks for patient autonomy. There can be a conflict on that front. Then, of course, beneficence and non-maleficence, where we know we want to do something for the patient, but then there's always some risk in their treatment or the modality that we are considering, or maybe there is a treatment which is not sure shot and it's still in the experimental stage. So there can be a conflict of should I really be employing this modality or not. And then, of course, truthfulness versus withholding information. So when we communicate with the patient, a lot of time, some information clinician may need to withhold and not be very, blatant in sharing that. So there's a conflict that should I be truthful and tell everything, or I should be holding the information. Resource allocation, especially when there is a scarcity of resources. We have recently seen during COVID-19 where we had shortage of beds, we had shortage of oxygen concentrator, we have shortage of oxygen supply. So we were really conflicted. Whom should I attend? The one who has come first, or one who is seriously ill, or somebody who is very well placed in society, or a VVIP. So definitely these can be reasons for value conflict for a clinician. There is some challenge. I think I'm not able to move this slide. So right, because this is okay, no problem. So coming to interpersonal conflicts. So we talked about intrapersonal conflict, where people experience conflict within themselves. They may talk with others, they may not talk with others, they may discuss and find solution, they may just leave it unaddressed, but then they are within an individual. Whereas interpersonal conflict is between two or more people. So what are the common conflicts in healthcare setting? Would you like to write in the chat box? Can I request you to write in the chat box? What are the common conflicts in healthcare, or with whom all do we normally experience conflicts? Okay, who is the leader of a multidisciplinary team? I think that's a very common conflict. Yes, between doctors there can be conflict. With team members there can be conflict. Absolutely. Then one treatment versus other, that can also be a reason for conflict. Absolutely. Colleagues and support staff. Yes, specialities. Boss and between departments, absolutely. Doctor versus management, absolutely, Dr. Vidya, I think I completely agree with you. Then conflict with administrator. Okay, thesis topic, especially when you are working on your, post-graduation or other higher education. Then doctor-patient conflicts, absolutely. Repeated investigation when you're doing and the patient is asking why all this, so there can be a conflict over this. Then everyday duties of conflicts, absolutely. Wonderful. So if I say broadly, common conflicts can be under following these headings. So conflicts with patient and their attendants. I think this is one conflict we are experiencing day in, day out with almost all our situation. Then there are conflicts with fellow professionals, especially with colleagues, with fellow doctors. Then there can be conflict with management, like you said, with administrator, with management, where there's a demand and supply conflict. Then conflict with external stakeholders like media, legal bodies, suppliers, that can also be, the reason for conflict. So let's look at the first one, that is conflict with patients and their attendant. So what kind of conflicts do we face with patients and their attendants? I can see some answers for the previous question, but very nice. Adverse outcome, absolutely. So when there is an adverse outcome, definitely the patient and family are not happy, and conflict is bound to happen if we have not prepared them for the outcome. Absolutely. Communication is a common reason for conflict. Cost of treatment, absolutely. Meeting expectations, especially if their expectations are unrealistic, it becomes very difficult to address them. Complications, yes, if we have not prepared them for complication or something that we have not discussed before the procedure, definitely that can be a reason for conflict with them. Pre-op diagnosis and post-op surprises. Yes, post-op surprises can be a reason for conflict. And then to do surgery or not. Yes, when you are recommending something and the patient party is not agree, so that means there can be a conflict. Seeing out of turn, yes, that's also one of the common conflict, that they don't want to wait, they want to be given priority over others. I mean, even if they come late, they want to be seen and given VVIP treatment. So sometimes that can be a reason for conflict. Management lines, yes, especially when we are planning something and the patient is not agreeing to it, or patient is not okay with the idea. Sometimes they say they want to try other system of medicine, and that this is the only treatment option available, but then in spite of your explanation the family does not agree and they want to go try other systems. So there can be a conflict between you and the patient party. Yes, time allocation can be a big reason for conflict. They feel dissatisfied, they feel that they haven't been given enough time, so they might feel unhappy, and they may blame you for being very casual or in hurry to treat. Then unexpected results, part of every, yes, absolutely. So especially if it is something that even you had not thought of, but that comes up, it becomes an issue for the patient and the family on the whole. Absolutely. I think you have covered almost all the points that I intend to cover in the presentation. So very rightly said, when there's a treatment disagreement, you recommend something and they don't agree, there can be a disagreement. Prejudice, absolutely. Prejudice, biases can be again a reason for conflict. Thank you, Dr. Siva, for bringing that up. Lack of trust. I think this is something that we are seeing day in, day out, where patient and their party actually do not trust, and we are on defense, and we have to kind of be on the guard so that they don't lose trust in us. We also see a lot of time communication breaks down between patient and us. There can be communication gap, there can be miscommunication, there can be, their communication needs are higher, or we are not able to meet their communication needs. So there is a discrepancy between their communication need and the communication that we make with them. Long waiting time and delay in treatment is also a very common reason for conflict between us and the patient party. And then, of course, discharge delays. I think this is another reason why patient party often goes, unhappy when they think that they are, the moment consultant says discharge, that means within few minutes or within an hour they should get the discharge summary and they should be out of the hospital. Whereas we know when we say discharge, it takes almost like 5 to 6 hours to actually do the discharge process, complete discharge process. But because they have not been communicated, they do not know the background processes that need to be undertaken, especially when they are on a cashless treatment and we need to get the approval from the TPA. So automatically it takes time. So there is a conflict between the patient and us, and they feel that we are sometimes holding them just to add another day to their treatment, and make money from that. A lot of time we get to hear this kind of allegation from them. And then of course, outcome dissatisfaction, especially if we have not been, we have not been able to prepare them for what is the likely outcome. And they have an expectation that I'm going to be fully fine and okay. So there can be outcome conflict between the patient and us. I can see some more answers in this. Coming late, I think that's a common practice area of conflict between the HOD and chronic latecomer. So even patients are unhappy when the patient has been called and the doctor is not in their chamber. They feel very dissatisfied, and they kind of now make a lot of noise on it, and they don't take it lying down. I mean, they don't mind even going and writing in the Google reviews that the doctor is unprofessional and is not available on time. So I think these are common issues that we see happening, between patient and us. Okay, and then of course, when there are socio-cultural differences, there can be a conflict between the patient and us. There can be actually misunderstanding between us and the patient. Language can be a barrier. If they don't understand our language, or if we don't understand their language, there can be a conflict because of communication gap or communication failure. Again, unrealistic expectation is also a very common cause of conflict with patients, especially if we have not been able to address their unrealistic expectation. Patients come with a lot of expectation. Sometimes they are unrealistic, but from their point of view, that's what they expect from us. So we really need to take out time and to address those expectations, to tone down their expectation, and to bring it to their realistic level. But then these are very common reasons for conflict with the patient and their attendants or their family member. Give me a second. I think this slide is still not okay. So another category where we can expect a lot of conflict is with other healthcare professionals. So they could be your nurses, they could be your junior doctors, they could be your senior doctors, they could be other people in the system. So there can be role ambiguity where the role is not clear who is going to do what. So there can be a conflict. People normally like to throw their responsibility on others. So they may say that's not my responsibility, that's not my role. So there can be a conflict between two categories of healthcare professionals, or in the same category, but there can be a conflict between the two people in the same set. Again, there can be a communication breakdown, especially when we haven't established the communication channel between people. For example, if a doctor is very authoritative or very aggressive, you will see their resident and their nurses will not be very comfortable and very comfortable in coming up to them and speaking. So they will usually be passive communicators, and there will be a communication breakdown. So that can also be a reason for a conflict between them and their staff. Again, resource allocation can be a reason for conflict between even healthcare professionals. Workload imbalance, especially if we are not careful about dividing the work between teams, and somebody is really overburdened with work and the other person is not given enough work, there can be workload imbalance that can become a reason for conflict between us and other healthcare professionals. Then hierarchical dynamics, we all know that we have a hierarchy in every system, but rigid the hierarchy, more chances of conflict. So therefore, wherever we have very rigid hierarchy, wherever we have very clear-cut, communication, do's and don'ts, and all those things, definitely there'll be more conflict between people working with them. So, for example, if the resident is supposed to be speaking only to the one higher up, and they're not supposed to be going and talking to the HOD, definitely if they go and try to do that, there can be a conflict between the whole team between them. And then, of course, we all know that there can be personality clashes. We have different kind of personalities among us. And if those personalities do not match, there can be personality clashes, if two people are aggressive, if two people are authoritative, if two people are very commanding and controlling, definitely there will be, personality clash between two. I think we have seen this very often in places where we have similar personality kind. Uh, uh, I will have to go back to this slideshow because it's not moving on its own. Okay, so there can be conflict with the fellow doctors, especially who are actually, managing the same patient. So you will see a lot of time there can be a disagreement over the treatment plan. So two doctors working on the same patient, they may disagree on the treatment plan. Or even on the diagnostic interpretation, there can be a conflict. Maybe one person interprets in one way and the other one interprets differently, and they don't agree, and they don't even clarify, they don't even sit and explain, they don't even sit and kind of understand each other's point of view, but because of their ego or disagreement or communication style, they may not actually sort it out. Then there can be disagreement on patient management. Somebody might say surgery, somebody might say medical management. So there can be a conflict even on the disagreement of patient management. Lot of time we see patients requiring, in cardiac intervention. So somebody might say angioplasty, the other one says, the patient requires bypass surgery. The patient is confused, whom do I go? But the clinicians don't agree with each other's point of view, and there will be a conflict over that. Communication style discrepancy can also be a reason for conflict. Some people are very, aggressive in their communication, or the other party could be passive communicator, or could be, passive aggressive communicator. That's very often a reason for conflict because they are not able to talk, in one-to-one adult manner, and though communication actually happens. Ego clashes, I think we all have seen this happening across, different sectors. And then, of course, professional jealousy. That's also one of the reasons we very often see, among clinicians and also non-clinicians, where people are jealous of each other. Okay, next slide. Okay, so if we look at the conflict iceberg, apparently it might appear that there's an issue that's reason for conflict. But very honestly, everything is actually under the water, which is not visible to all of us. Usually it is about personality, it is about the emotions, it is about the interests, needs, and desires. It is about self-esteem, low self-esteem, high self-esteem, expectations, interest. So all this could be actually underlying, or some unresolved issues from the past, which could be actually, precipitating in the present situation, conflicting the situation. So it is not just the tip that's visible to us, which actually is the complete picture. But you really need to go down to find out what is the reason for conflict and how this conflict can be resolved. Now, coming to the point, how do we handle conflicts? So for this, I had shared a questionnaire with you, and that was, that Thomas Skillman resolution model, which I shared with you. So I gave you that questionnaire with the idea that it will give you an opportunity to know about your, resolution model. So in that, I hope you could all do the scoring also, because I had given the scoring format for that, and also you could write your scores in that, and also find your way of handling conflicts. So would somebody like to write their conflict resolution style that they have been able to identify in the chat box? If some of you who have taken this questionnaire, those who have not taken, Dr. Vidya has shared this questionnaire in the chat box. I request you to take it, and even I think she has messaged on WhatsApp, so you can take that questionnaire even later. But that will give you an idea about what is your communication, or what is your conflict resolution style. So, okay, I can see Dr. Manjunath has written collaborative on. What about the second one? I want both. I want to know both. Please write the lowest one and the second lowest one. So like I can see Dr. Hemangni has written collaborative, dominant, and authoritative backup. Absolutely. So I want others also to share their conflict resolution style. Write both. I got 7 for all others. Okay. So that means you will be choosing depending upon the situation and people that you are interacting with. Okay. Okay. So have more people taken this? Okay. Okay. Collaborative style. Okay. Followed by both accommodating teddy bear and compromising fox at number 2. Okay, Dr. Vidya, that means your first style was collaborative and the other two are the backup. So what I'm trying to say by the first and the second one, the idea is that there is one primary conflict resolution style, which is your dominant one, which you use often in your day-to-day conflict resolution. But there's a backup style. That means if that does not work, what are you going to choose in the second option? So, for example, for Dr. Vidya, you will try collaborative. If that does not work, then you are more likely to choose either accommodating teddy bear or compromising fox, either of the two. I'll explain briefly about what these other styles are. So I got 3 for shark, owl, and turtle. So Dr. Yogesh, that means you are using these 3 alternatively depending upon the situation and the person with whom you are in conflict with. And other explanation of conflict resolution style is that the first with the lowest score is your conflict. Somebody's device mic is on. Can you please? Thank you. So a lot of time, the one with the lowest score is the style that you will use in your professional life. And the second one, we are more likely to use in our personal life. So that's also one of the interpretation for all of you. So let me quickly explain you what this model says. So this model says that we have 5 different styles of handling conflicts. One of these style is called avoiding style. So as the name explains that it is a non-confrontational approach where we actually just do not, get into any kind of confrontation and we just avoid the conflict. So the benefit of using this style is that there is no conflict, at least apparently, and it will not escalate. So what you are going to do, you are going to postpone the issues, you are not going to address the issues. So automatically you are not addressing the issues, so relationship will be maintained automatically, but that is superficial. Actually, in reality, it will breed resentment because you cannot always use this style in all spheres of life. It's okay to avoid in a place where you think the benefits of confronting are minimal or it is not useful. So one can always, take that approach. But if that's my regular way of handling, situation, then the problem will be that it will not resolve the issue. Only that you are kind of, able to brush it under the carpet, but there can be a lot of repercussions. So it will breed resentment and also the problem will not be addressed and unresolved issues will be many. You will see this. There are, head of the department, there are consultants who would not address issues. So automatically there will be a lot of chaos under them, but apparently everything will look nice and okay, but that is not the truth. The issues are there. It might burst out like volcano maybe later. So this is also called tortoise style, where you get into the shell to protect yourself from the situation. The other style of conflict resolution is called competitive style, where you use authority and you compete with others. So it's also called shark style, where you kind of attack others and you want to, resolve the thing by taking proactive approach. So the benefit is, yes, it's goal oriented, because if you are a taskmaster or if you want the work to be done, definitely you will be authoritative and you will be dominating. So you will get the work done. It's quick and shortcut. But at the same time, there will be resentment, but especially for people who will not be able to come up to you and discuss their concern or share their ideas, their conflict will not be resolved. Only thing is their conflict will be brushed under the carpet. It's only you who will be able to get the work done. So automatically, that's not only going to breed resentment, but there will be hostility and people might revolt in the time to come. Also, there will be lot of unresolved issues and problems which you may not come to know, especially people who are authoritative, aggressive, or intimidating. They will use this style where they just order and they get the work done. But then lot of issues that are bothering others will not get resolved. The third style is accommodating style, where you will see people, as the word says, teddy bear style. So that means they are ready to accommodate anybody and everybody. So they will adjust and cooperate to a very high degree, which is actually really liked by everyone. And these people are really liked by one and all. And these people will actually give in to maintain relations. So they don't want to spoil the relation. They will agree with anybody. They will also go out of way to help others. They will also sacrifice their personal needs and interests to accommodate others. So the benefit will be that there will be, minimal injury, because definitely everybody will be kind of happy with them because they will try to fulfill others' needs. At the same time, relationships will be looked after. But the cons of such kind of a style of management or style of conflict management is, again, this will breed resentment. Ultimately, when you continue accommodating at the cost of your own needs and desires, you are going to feel unhappy about it, because your needs and your priorities will not be looked after. And also, the risk is weak will be exploited, especially the person who is weak and is accommodating. His or her needs will be exploited by others because their rights will be forfeited and they will be taken for granted. The fourth style is called compromising style, which is more like a middle ground approach, where you say, okay, I'm ready to give up 50% of my plan or need or desire, and you need to also sacrifice your 50%. So benefit of this kind of style of conflict management is that when there is a complex issue and there is no simple solution, people accommodate by giving up some of their rights or their needs or their desires, and they compromise. Especially when all parties are in equal power, you cannot dominate the other one, you cannot snub the other one, and there you will have to give up something or give in something to let the other person agree with you. So the benefit is that at least both will get some part of it. But the cons of such kind of a style is that no one is ever really happy and satisfied, because ultimately they have to give up some of their needs or desires, so they will not be happy. The fifth one is collaborative style, where the problems are solved in a collaborative way to cause minimum damage to both the parties. So this style is also called owl style, where people try to, create mutual trust. They try to sit and, work over the problem, identify the problem, look for solutions, and they see that they not only maintain relationship, but they also maintain respect for each other. So automatically it will not only create trust, but it will also build commitment from both the parties. The benefit of this is that both parties will feel that yes, I could express myself, my concerns were addressed, and ultimately what we have chosen is best for all of us. But the problem with this style of conflict resolution is it is very time consuming. It's not easy to find a solution that fits for all. Also, at the same time, the energy required to work on this style of conflict resolution is also a lot. So you will have to really make a lot of effort to bring everybody to a table where everybody agrees for something. And also, if the other party is not in the same mind frame, suppose if they are competitive in style or they are, avoiding style, then you will find it very difficult to use this style of conflict resolution. So you will see that collaborative style, of course, is the best option, but then it takes a lot of time and energy and efforts for the person to actually try something like this. So if I put all these styles on a grid, there are two deciding factors that decides your conflict management strategy. They are concern for self and concern for others. So when you are avoiding, your concern for self is low, and your concern for others is also very low. So you're avoiding, you don't care how this is going to harm you and how it is going to be disadvantageous for the other one. When you are in a competitive style, your concern for self is very high. You know what you want, and you want to make sure that you get what you want, but you don't care for others. You don't care for how they're going to feel out of it. Are they going to be satisfied? Are they going to be happy? So that's not your concern. So your concern for others will be low, but your concern for self will be very, very high. On the other side, when you are trying accommodating style, you will be concerned for others. So your concern for others will be high, but your concern for self will be again. That's again not going to be a very helpful one, because ultimately, if you keep sacrificing your interest and your needs and your priorities, at the end of the day, you feel that you didn't get the share of happiness that you should get. So I see this kind of thought process among parents. So when they do a lot for their children, they sacrifice their needs and their requirements to look after their children, and that at the end of the day, when their children are not able to reciprocate for any reason, there is a resentment that I did everything for my children, but they did not look after me, or they did not fulfill my need. So again, accommodating style to some extent is good, but then if you are sacrificing all your needs and desires and priorities, at the end of the day, you are going to be unhappy. So the best option will be collaborating, where you not only put yourself on priority, but you're also, concerned about others' welfare or their needs, or what do they want. So you try to find a way which works for both the parties, and it creates a kind of a win-win kind of a situation. So there's a very beautiful tool that I came across, and this is called interest-based relational approach, which is a very useful tool when you are actually working on creating a way out where both the parties go happy. So this is a framework which emphasizes, where we actually try to first of all understand the underlying interest and needs of all the parties. What do the other party want, or what do the other party need? So if you are able to identify that, you will know what exactly we are looking at. So you can also define it as a problem, that okay, we are looking for something that works for him and for me. And then you try to, in a collaborative manner, you try to solve the problem and create mutual gain for both the parties. So this approach actually, helps us to uh, find solutions that work for both the parties. Okay. So the interest-based relational approach says that first of all, we have to focus on interests and needs of both the parties. That has to be the first defining factor. And then we need to separate people from problem. So you may not like the other person, but when you are focusing on the problem, you will have to separate both the things. Because if you will look at the person, you will not be able to focus on the problem. So very mindfully, you will have to park your personal relationship with that person and look at the problem and see what can be done to resolve that problem. And then when you work together, you can find different options that the other party might bring in. And you may also have an idea where you explore those ideas and you see what works for all of us. So to do that, when you use objective criteria to select a solution, automatically you will find a way that works for both the parties, and that will help you maintain relation. So when you use this approach in your conflict resolution, automatically you will be able to create a win-win kind of a solution for both the parties. So in this kind of a conflict resolution style, you really need to bring in active listening, where you try to understand the point of view of the other person. You may not agree immediately, but let us listen to the other person. Then at the same time, when you practice empathy, try to look at things from their point of view, probably you will have a deeper understanding of their problem. When you look at their body language, you will get an idea of what they are feeling, how comfortable they are interacting with you. Are they expressing themselves honestly in an open manner? Look at your own body language also. A lot of time verbally we don't say anything, but the non-verbal body language communicates intimidation, anger, irritation, unhappiness. So automatically it cannot be a win-win kind of a situation for both the parties. And then you need to focus on the conflict process rather than just the conflict. Then of course in that situation, we need to, connect with the other person, clarify what are their concerns, then confirm to make sure that you're working on the same uh, problem, and then work towards to find a solution. So a very important communication skill that can help us handle this situation, and that is called assertive communication. Assertiveness is a communication where you not only talk openly and honestly about your feeling, but you also listen to the other person. You allow the other person to share their point of view. You accept their viewpoint. You may not agree, but at the same time, you may agree to disagree. And then finally, you take the responsibility of action. So that means in assertion, you look after your needs and you look after the other person's need. So two factors again that will help you to stay assertive is where you are trying to stay cooperative and also communicate in an assertive way. So degree to which you try to satisfy the other person's concern is cooperativeness. So as I said, in conflict resolution, I think the approach has to be, where you want to cooperate with other person to find a solution. And then of course, it's very important to be able to communicate what is your concern. So even if you are communicating with your senior, but you need to be able to communicate with openness and honesty and express your feelings and thoughts so that you are happy that you could communicate your concern. So when you are trying to find solutions or when you are trying to, find ways out of a situation, you will never get a ready-made solution. You will never have a ready-made solution. You will have to find solution. But when you work together, when you have defined the problem, when you listen to the other person, what the other person wants or is suggesting, maybe that works for both the parties and you can choose. So you really need to work with each other to find a solution. So for this, I want to give an interesting activity before I close this session. And that is, I request all of you to, draw these 9 dots. I hope some of you have a copy and a pen with you. I'm not sure if you have it. If you can quickly get a copy and a pen and draw these 9 dots in your notebook. And can I stop sharing if that's okay, if it is visible to all? So draw those 9 dots on a piece of paper or in a notebook. Okay. Now connect these 9 dots with 4 straight lines without lifting your pen. I repeat, connect these 9 dots with 4 straight lines without lifting your pen. Could anybody do it? Nobody? Ma'am, you couldn't do it? Okay, no problem. There's a study by Harvard that says, oh,
I
sir,
tried
how
it,
many
but
lines? 1, 2, 3, 4. 1, 2, 3, 4. Sir, these are 5 lines.
yeah.
4 lines. I was very happy to see. I said, very nice. You could do it. I was very happy. Can you bring it closer? Sir, आपकी 5 लाइनें हैं. This is not valid. Anybody else who could do it? Dr. Anjali, please unmute if you are saying something. Please unmute your device. I'm not able to hear anything.
Yeah.
Yes,
Now,
please.
are you able to see, ma'am?
No. Put it slightly, in front of the camera. It's not in focus. Try.
Okay.
Not too close, not too close.
So, Dr. Anjali, if I open whiteboard, will you draw and show? Can you draw and show?
Yeah.
If I,
Yeah.
huh? Okay, give me a second to open. So only Dr. Anjali, you will be doing because you have done. So I am opening. Yeah. Okay.
Yeah.
So I have opened whiteboard.
Okay. Let me see, ma'am.
Yeah.
Now.
So whatever drawing you have done on your notebook, if you can draw on
Yeah,
the
yeah. Yeah.
right. Yeah, sure.
Yes. So now, suppose I select here.
So you will have to select T. That is, you will be using.
Where I have to select?
So I can't see the normally on the left hand panel there is a option. What tool do you want to use? But it's not showing any tool.
Okay.
Let me see if it is working. No.
Uh-huh.
No, I can't see any
Page
tool.
1 is there. Page 1.
I'm sorry, I think I will have to close whiteboard because there is no, it's not showing any tools on the left hand side. Oh yes, I
now,
can see it.
now
Yes,
you could see?
yes, Dr. Sunita has done it. Yes.
Madam, can you see now?
Dr. Anjali, tell me, is it same like Dr. Sunita?
Wait. I have not
Dr.
seen her.
Sunita, show once
No,
again.
we haven't seen it.
Yeah,
No,
Dr.
I haven't seen. Let me go through.
Dr. Anjali, have a look at Dr. Sunita's camera. Is it same?
I could not see her, madam. No.
Oh,
I have, madam, I have three vertical lines, and passing through is a transverse line.
no, but then you must have lifted your hand to draw 3 vertical lines, no? See, the idea is that you don't have to lift your pen. Once you start, you have to connect. Like, look at Dr. Sunita's.
Okay,
yeah.
okay,
I
ma'am.
think you have
Okay.
joined using.
And you need to take the line outside the dots and then come back again.
Absolutely, absolutely. I think
Okay.
that's the message.
So one
Absolutely.
step I have missed, ma'am. Yes.
Yeah, no problem. I'm showing you how to go about doing it. Give me a second. So you can actually connect all the dots with 4 lines, but you have to go out of the box. The whole
Okay.
idea about this exercise is that we normally think in the box, that this is the only solution. But if you will go little outside the box, you will be able to find new solutions to these problems. So there's another way you can actually you connect these 9 dots with with 4 lines without lifting your pen. And you will be surprised to know that you can also connect these 9 dots with just 3 lines. Here we go. So just to quickly summarize, I think conflicts are inevitable. They are going to be there. They are part and parcel of our life. I think more important is how we manage these conflicts. And if we manage these conflicts, I think we are good to go. Conflicts can be handled in many ways, but positive approach and win-win approach is always better than any other approach. It may be time consuming, it may be energy consuming, but then in the long run, I think this is something that will work for all of us. And then all the at the end of this kind of an approach, both the parties are happy, and that's what we are looking for. So I'll stop sharing here, and we can hold the discussion.
Thank you, Dr. Indu. Over to you, Dr. Jamila.
Yes, thank you.
Thank you so much, Dr. Indu. That was really entertaining and engaging, and you managed to keep everybody's attention for the session. You were very inclusive, very comprehensive, really covered all the aspects. So that was really interesting. And there was a lot of information. So I hope people to whom it is a sort of new subject would have been able to get everything. Okay, so I have a few questions and comments which I would like you to interact with as other people also get ready to prepare their own questions. And the first one that I thought of was, you focused on interpersonal conflicts and intrapersonal conflicts. And my question is, would you think that intrapersonal conflicts, if the person has not resolved them, and if there are a lot of them, would that lead to that person getting into more and difficult interpersonal conflicts? That's my first question.
Absolutely. I think unless we are comfortable and at ease with ourselves, we wouldn't be able to deal with the world in a very objective manner. Because if we are conflicted inside, that's bound to cause cognitive dissonance. So when we are not happy, satisfied, and not balanced, so our ability to deal with adversities and different situations will definitely be affected. So therefore, we say inside has to be peace to deal with the world outside.
Right. So if a person is getting into a lot of interpersonal conflicts, one can presume that there is something going on inside that person. They would probably need some kind of help or some kind of time to introspect and deal with their own conflicts first, right?
Absolutely. I think once we handle people with the adjustment issues or, work related or personal life issues, when we try to kind of investigate or go a little bit deeper, we do see there are reasons, in the background, which are leading to these kind of thought processes.
Right. But sometimes people are not ready to deal with that, right? That is sometimes a block to dealing with conflicts. That is what sometimes comes up. Okay. Another question which came to my mind is, you stressed in in your relational approach to solving the problems, that the approach that you focused on at the end, that cooperation and assertiveness have to work together, right? So what are the blocks to cooperation? Why is it that sometimes people are not able to cooperate to solve the problem? What are the blocks to cooperation and how do we deal with that?
So a lot of time, I think conflict of interest can be a reason for not cooperating. Approach can be a reason. Communication style can be a reason, because people do not know how to communicate that, yes, I am cooperating or I want to cooperate. People just take it lying down, whatever comes to them, and they're okay with it. A lot of time people are passive aggressive in their communication. They don't cooperate, but they don't even come out saying that I'm not cooperating for this reason. Of course, sometimes we don't value relationship. That also is the reason. When we don't value our team, when we don't value our fellow professional, we think I'm the boss and I can manage it and I don't require anybody. I don't need to cooperate with anybody. People need to cooperate with me. Why the hell should I cooperate with others? So these can be very conflicting. Yes.
Right. So it becomes very difficult to sort out the conflicts there. And then emotion itself, would that be a block to, when emotions come in the way? When we talk about cooperation and all that, that's great. But sometimes the emotion, like you said, the jealousies which are not sorted out, the internal conflicts. So sometimes that can be a big problem. Don't you agree?
Jealousy, and also when there's a fear of a threat to the identity or integrity. Yes. Also, when you have low self-esteem, people with low self-esteem also may not cooperate, thinking that if I cooperate, I'll be considered as, ineffective or not very controlling kind. So they would just not take things. They would not cooperate.
Right. Okay, I will allow Dr. Bhagat also to ask some questions, and then perhaps other questions will come from all the other doctors.
Sure.
Dr. Bhagat, your comments, please, and then if you have any questions.
Thank you, Vidya, and thank you, Dr. Indu and Dr. Shabina. I think it was a very comprehensive presentation. A few things that, it's just a question of vocabulary. If one were to use another vocabulary, there are structural issues that one needs to look at, which is the boundaries in a relationship, whether the boundaries are rigid, fixed, or diffuse. And if those boundaries are not looked at, then the communication becomes difficult. And that leads to a number of things that we've talked about. If there's a fluidity of roles, along with the structural issue of the boundary, then it becomes very difficult. So if you're a team and if you're allowing too much information to come from outside, then it becomes very difficult. If you're a team and you're allowing too much information to go outside, that also becomes difficult. So, and that leads to conflict. Similarly, if there are systemic issues, sometimes individuals are blamed for conflict when the organization itself has systems that generate conflict.
Yes.
So if if, for example, the HR has not clarified that VP operations will be doing this and VP, let's say finance will be doing this, or VP IT will be doing this. If lines of reporting are not clearly managed, if, for example, leave policy is not clearly managed, if admission policies are not clearly managed. So some of these policy issues are organizational issues, which actually are there to precipitate conflict. And when these conflicts are precipitated, it seems like individuals are at war with each other, but it's actually the organization's management trying to create a hierarchy, trying to create a power structure within the organization, and one needs to be wary of such things. And going back to get the interrelational approach, getting to yes, that's a very well tried out approach, I think. But one thing that I must mention in that approach, which I took away from that approach, is that you have to be sure of your non-negotiables. So you have to agree on the similarities that you have with the other person. That's where you start from. But you also have to be sure of what is non-negotiable for you, and that's where the value framework should be your test. Framework. If things are, agreeing for the sake of agreeing to reach a conclusion or to find a solution beyond a value framework cannot be acceptable.
Absolutely.
For example, in on the issue of sexual harassment, for example, you can't agree to let go of the issue if you are sure of the value framework, even if it means conflict within the team, even if it means that some people are totally against the action being taken. But if the value framework does not allow that, then the value framework does not allow that. You have to be clear about the non-negotiables, because if you're not clear about the negotiables, then it's very easy to do a group think. And it's very easy to continue to believe that we're doing well.
Absolutely. Thank you. I think that was a very valid point, very, very useful point that you have added. Thank you so much.
There's a question in the chat box. There's a question in the chat box. What is your opinion on the method of conflict resolution with seniors with low self-esteem? So
I think assertion is one thing that helps in most of these situations. So when we are supportive with our seniors, especially with those who are, with low self-esteem, that means they are not open to discussing or coming out with their vulnerability. So having team members who are supportive and who are compassionate and who are, trustworthy, but at the same time they assert, it can open a communication with them, and we can explore issues that are bothering everyone. But then coming out in an aggressive manner will definitely shut them further, and they might even create a wall between them and the juniors, and that will be very difficult to break that.
Also, whenever there's a group, if there's a group leader, there'll always be a upcoming group leader who would challenge the group leader. And then there will be a person who is a please-all person who would try and benefit from the conflict between the two of the group leaders. So when you're in a group, one needs to be very wary of the group dynamics as well. One needs to be aware. We are all mature professionals. Whenever there is a group, there will be group dynamics. And falling prey to the group dynamics and then causing a conflict. And that's why I use a term called digital conflict and an analog conflict. Digital conflict is the one that is visible to us. But the analog one is the one that is actually causing the problem. So unless we get to the analog conflict, we'll keep on solving one conflict after the other.
Dr. Rajiv Mahajan, you have your camera on. Did you want to say something? You're muted, Rajiv.
Dr. Vidya, there's another question in the chat box.
Yeah, there are several. Dr. Venkatesh, would you like to actually speak up? You have typed quite a few comments and questions.
Yes, ma'am. There are two things, ma'am. Can all conflicts be resolved? Number one. And number two, when is it that one should kind of give up from the act of actually resolving a conflict?
So even if we are not able to resolve, if we can bring it to a level where things can go on, we can actually get the work done. It may not be possible to 100% resolve conflict, but then there's a place where both can agree to disagree, but then work on same, area or the same place. That's how you will have to create kind of a kind of a balance between the two. So that's one thing. And what was your second question?
When do we actually give up?
So I think, if you have tried a number of times and you feel that nothing is working, so sometimes even it is okay to accept that maybe things are not in your control, because ultimately, if you will look at this situation from Stephen Covey's point of view, where he says that there are two big circles, that is, one is circle of concern, things that are not in your control, and there is circle of influence, things over which you have control. So people, situations, and past is not in our control. Please remember. People, situation, and past is not in our control. So unnecessarily wasting your time, energy, efforts to an endless extent is not going to help. So in my case, when I try my level best, and at the end, if I feel that this is not going to change as per what I'm expecting, so I have coined two words. Of course, that's for my personal life I'm sharing with you, not for my professional work. And I use those two words to give myself satisfaction and happiness. And those words are Hari Ichha. Hari Ichha. So that means it's God's will, and that I can't go beyond that. But honestly, in workplace, definitely, if you are little creative and open-minded, and you are, seeking guidance and help from others, you are able to find solutions that work for most of the situation. I was reading a study that says every problem has minimum 4 solutions, and every problem should be tried at least. Every solution should be tried at least 4 times before you give up. So there are a lot of ways to handle a situation. We should not easily give up. But then there will be a point where you will feel that I've tried my everything and it's not working. So sometimes even acceptance helps to handle a situation. Parking on one side also is a way.
One more question. Can I ask one more question?
Please.
Are humans naturally endowed with this ability to resolve conflicts? Is that the way that we are built? And is it an acquired skill? One has to consciously work at it.
I think we have learned it by way of evolving, I can say, because if you look at the humankind, how we have evolved, we have learned that that's one of the ways to maintain relations and live in a society. And but this has evolved over time. This is my understanding, but I would request Dr. Achal Bhagat and Dr. Koshi to share their thoughts on this question.
I actually want to go back to the previous question that Dr. Hitesh asked. There are two skills that I use as a therapist, which sometimes help. One skill is called therapeutic impotence. So if one is stuck and it seems like one is pushing the wall, then saying there doesn't seem to be a solution and probably we will have to accept, not actually accepting, but saying that one needs to accept the status quo. And is status quo acceptable to all of us? Getting people that allows people to reflect, that is status quo acceptable to all of us? And because status quo is not acceptable to all of us, what is it that we can do differently? It eases the slugfest that's going on. The other thing is that sometimes getting in a neutral observer for the resolution. Now, this is a neutral observer as opposed to a mediator. Because when you get in a mediator at one level, you are disempowering yourself or disempowering the process. Sometimes it's useful to get a mediator as well, but sometimes when you get a mediator, you are disempowering the process. But getting in a neutral observer, like a third umpire, to sit through the process and just point out where we are repeating ourselves and where we are actually saying something and doing something else. The neutral observer is just the observer of the process, not the facts and of the matter, not the merits of the matter, but just the process. So if somebody observes the process and keeps on pointing out the process, it allows you to move on from there. As far as the history of human beings, I think we will have to go to Yuval Harari to find that out. I don't know the history of human mankind that well.
I think human beings are incredibly complex, and some people are endowed with a little more empathy than others, just personality wise. So they are able to kind of instinctively cooperate and empathize with people, listen to them more. So they are better placed to find collaborative solutions in, resolving conflicts. Whereas some people by personality tend to be more rigid or dominating, so then they tend to go with the competitive style. So yeah, I think it's a learning process, definitely. In fact, there's an interesting question in the chat box whether diplomacy is required in healthcare conflicts. And what do you think, Dr. Indu? Is diplomacy part of a collaborative style of conflict management?
So a lot of time for very complex problems, you may not be able to find a straightforward answer or a solution. So there, I think if you can strike a balance and find a solution that creates some amount of satisfaction among, because it may not be possible for you to create happiness for one and all in complex situations. So maybe there you will have to go for something that works for most of the people. But I would request both of you to share your thoughts also on the same.
There's an amusing comment here about some people being creative in keeping conflict alive.
Problem shooters. True. We have all sorts of people. I agree.
There's another comment from Rajiv, which I just replied to him, where he asks for or comments, even love is an acquired skill. I think love is an acquired skill. There is a person called Eric Fromm who talks about art of loving, and you don't fall in love, you have to stand in love. And that's true of most relationships. You have to continue to work on the relationship in an ongoing manner. There is nothing spontaneous about managing conflicts. You have to work on it.
There's a question here about, are there studies correlating the scale predicted with perceived style of conflict management? I presume he's talking about the Thomas Kilmann scale, Dr. Indu?
It's an established assessment tool, yeah.
But at one level, I would also not get too bothered about categories. if you were to look at conflict as a pattern of communication and managing that also as a pattern, there'll be a continuum of interactions that you would have. And it'll change with, for example, if I have a conflict with Vidya versus having a conflict with Jamila, my patterns might be completely different in the two interactions, because it will not be I who determine that; it will be the interaction that determines that. So I don't think there will be a fixed way of managing conflict. Of course, there will be some patterns that I follow over and over again, and I need to be aware of those patterns, but I would not get too worried about categorizing myself as a fox or an owl.
So I think the whole idea about categorizing is that one of the style is mostly dominant one which we use often, and we see people, if those who are very competitive or authoritative, you will see across their professional arenas, they will be in the same, they will interact in the same manner, and even in personal life, they tend to showcase same traits. So therefore, I think that's what we are trying to say, that people who are avoiding kind, they will avoid workplace conflicts, and even in their personal life, they will avoid conflict. Especially these are not very desirable styles of conflict resolution. That's the point probably I was trying to make, that one should not try to avoid or be too competitive, but then one should be focused on collaborating and try to accommodate with others. That's what the message is.
True, true. And in this dimension, the other diversity issues will come in, because if you're talking about organizations, other diversity issues about gender, about caste, and about language, about ethnic origins would come in. And those biases and prejudices will unfortunately sustain such conflict.
Absolutely.
So
So
Dr.
I think this
Manjunath,
tool was in a very lighter way. This tool was given to give you an idea about what is your, kind of conflict resolution style. I mean, if somebody wants to really know it in detail and in depth, then of course there must be some very detailed tools that can help us. But this was just to create an awareness that these are the primary styles we all adopt, and pros and cons of each style.
Two interesting questions.
Dr. Manjunath wanted to say something. Sorry to interrupt. Dr. Manjunath, you had your hand up.
Yes, ma'am. Actually, I asked a question that this Thomas Kilmann scale, does the result of that particular result, does it correlate with the actual personality? I asked this because I had attended a similar workshop recently in our institution, that is in Pondicherry. And what I saw is one of my group mates, whom I know personally because he is my colleague also in the department, actually had a bad score, which showed that he is not able to handle he will not win the conflict. That was the result. Like, how well you will be able to handle the conflict. So I felt that maybe the Indian, the population does not understand because they're very repetitive and they're very vague in nature. So, are there any studies which are addressing this to see that correlation? And that in that angle, are there? I just wanted to know.
So very honestly, I have not gone into great depth of it because I have not studied conflict resolution from that point of view. But usually, I use this tool to help people know that these are different styles, and some of these styles could be dominant for some people, and then it creates awareness. But I haven't done any in-depth study where all this tool has been used, and if there are some outliers or some biases.
Right. I also had one more interesting observation, ma'am, while filling up the form, and even in the previous workshop also, as I mentioned, that the way I will be dealing with the conflicts in professional space will be very different from what I will do in a personal space. Because I have different degrees of power at various places, so I'll be handling it in different way. So I think it's same person. We cannot put it in one box. Is my conclusion.
I think that's what I mentioned, that the lowest score is the one which you will most likely use in your workplace, and the second lowest will be the one which you will use in your personal life.
Right, ma'am. Right. I would like to thank for the wonderful session, ma'am. Thank you.
Thank you so much for your questions. Thank you.
And also,
Yes.
like Dr. Achal Bhagat said, don't get too much, fixed with the styles. Yeah. Dr. Jamila, sorry to interrupt you. Go ahead.
No, I was just saying that there are two more interesting questions which you could just touch on. One was, what is the role of movies in fostering aggression and stuff like that, and giving a role model in how to deal with conflicts? And what is the role of gender? Are women better than men at conflict resolution, or the other way around? So you can take that, Dr. Indu. Yeah.
So I think we do get influenced by movies, especially when we are in impressionable age. But then, of course, if any movie has a good message, people do, get become aware of different ways of handling conflicts. And I mean, especially if they find a new perspective or a new idea and they find it useful. We have seen people emulating that or trying to copy that. Movies do have influence on all of us in some or the other way. And when it comes to conflict resolution, I think maybe women by temperament are,
Or conditioning.
are more into conflict resolution, because one is that because they are always in the mood to adjust or find ways out of the situation. But I don't think I have any study to tell to prove what I'm saying. I'm just sharing my thought that maybe it's women more who are considered to be more adjusting. I think men can tell us better what do they think about
Ma'am,
this.
can I be allowed to make a quick comment on the
Please,
movies?
go ahead.
On the movies in conflicts. Actually, I saw one a video in YouTube, where it was said that, I think it is true, where a Indian guy in Australia was acquitted. He was charged of stalking a woman in Australia, but his lawyer argued that he comes from a culture where in movies they show forcing a woman to love and harassing a woman to love her is part of the culture, and so he should not be blamed for that, and he was acquitted. So
Good Lord. Yeah. So Shiva, you had your hand up. Shiva Pillai.
No, I just have a thing on my desk, I found this, I was an Orwellian at one time. The mother suggested one time that we should concentrate and be true to yourself. It is, I can't get the actual wording now, but it's on my desk. One needs to be true to oneself, follow one's passion, strive for personal growth, even in the face of opposition. And if you concentrate and focus on your personal development in pursuing your aspirations, then any conflict can be overcome or transcended. So I wanted to say to Indu, there is one more category where you don't have to be in those 5 categories. You can transcend conflict because you, in your personal growth, you have said to yourself, I'm not going to be involved in this. I know for myself that this is better. I am better than this. I have pursued better. I have done better. So I'm not going to get involved in this. And you transcend the conflict, and that will lead to greater harmony and fulfillment within yourself. You may not solve the problem about the conflict that exists there, but you get harmony and fulfillment for yourself, not because you have compromised or anything, but you have stayed true to yourself and you know that you did the right thing. So I think that's a category that one needs to look at also, because that's on my desk and I just thought I should share it.
So I think once the person is in the self-actualization phase where he is little, over and above the bodily consciousness and also the day-to-day issues. So they're focused more on finding out what more they can do or how they can make better, or also if they're in their spiritual consciousness. So definitely those people would be less inclined to get into these kind of conflicts on day-to-day basis, then they would just kind of find a side way and move away from the situation and find their own way while maintaining their harmony and peace.
But I wonder whether technically speaking that would come under competitive style, because what you're doing is saying that I'm doing what I think is right, and I hope you manage with it.
I would call it the
What do
Twitter
you think?
style. Ignore the trolls.
So, Radhakrishna, would you like to come in? You had a humorous take on this whole thing, but Dr. Indu drew the line. She said she's talking only about professional conflict and not personal.
After this long lecture and wonderful discussion, I understand that as humans we are in conflict all the time. I mean, every day, day after day. See, I think the conflict starts from birth. Actually, we are conflict creators and resolvers from the time we are born, either as a son or a father, a grandfather. You evolve and you try to be part of it and also try to resolve it. And having said that, in medical profession, since most of us are in a high intellect level and high competitiveness and selfishness, I think we have many more conflicts in our profession than any other profession. And actually, these conflicts seem to be more during our younger days. And as many of the panelists have discussed, as we grow old, we are more of a conflict resolvers than creators. And I think spirituality at some point of time also adds to this. So I think we all should understand and realize that the conflict's everywhere. Many times we don't realize there's a conflict and we also try not to resolve them. I think this session today opens our eyes to, to look for conflicts everywhere and try, see whether we can be part of resolving team rather than a part of, conflict team. Is a great lecture. And I think as Dr. Indu rightly said, this is a beginning and there's a lot more to understand as far as conflict resolution is concerned. Thank you so much.
Your closing comments, Dr. Rachel.
I think it's left. Okay.
Okay. Right. Your closing comments, Dr. Jamila.
Yes, thank you, Dr. Indu, for a very comprehensive and, as I said, a very
Absolutely.
engaging and entertaining session where you were able to keep all of us involved and on our toes with all the activities and the conversations and chat. Thank you, that was good. And I guess what you were trying to say was we should understand our competitive styles and the reasons that there are conflicts in our healthcare setting. And you covered a lot of the issues that come up. And if we can just keep our minds not to get fixated on these styles, but just to remember that ideally collaboration is the best way to go, right? I think that would be the message that we can take away from here. So, yeah, thank you.
Thank you so much. Thank you.
Rachel is back.
So briefly, I think what I'm taking away is it is possible to get to a middle ground, and but we have to be sure of our own ground before we get to a middle ground. That's one thing that I'm taking away from this session. But probably the more important thing that I want to underline is that conflicts get layered and they cause a lot of distress and dysfunction. And it's important not to allow them to get layered and address them rather than ignore them.
Thank you.
Thank you, Dr. Bhagat. Dr. Indu, there's a last question which probably you could answer. Is there any difference in handling conflicts among various generations? Like, do you see the way they handle, is it different or not necessarily so? You could have a younger person doing a authoritative style. Does that happen?
So I do not know of any study, but that general observation tells that when we become more experienced in life, we know that some conflicts need to be addressed and how we need to calmly, observe and interact and express and also listen to the other person. With the younger generation, maybe fully not aware of how do you go about handling conflict. So they have a tendency to kind of, express more and showcase their thoughts and ideas rather than listening to other person. But I don't think, I mean, I am in know of any study that can actually prove this discrepancy in the two generations.
Your closing comments, Dr. Indu. We have overshot our time.
Yeah, I know. So I would really like to thank all of you to have really, contributed greatly to this session and participated with a lot of enthusiasm. And thank you, Dr. Bhagat and Dr. Jamila, for giving interesting input to the program and making this session useful for one and all. So my takeaway for me and for everyone is that conflicts are part of life. So we have to, first of all, learn to accept them as the reality of life. But at the same time, not all conflicts are bad. Conflicts are functional conflicts also that help us grow and become better, because when we critically think and creatively find solutions, we come across a lot of new ideas to handle them. And then also we should be resolving them rather than brushing them under the carpet. And one should try for collaborative style, because that brings happiness, peace, and satisfaction for one and all. Thank you.
Thank you, Dr. Indu. Thank you, everyone, for an extremely interactive session. Dr. Vasumati has put some articles also, which I have just copied on the chat box. And the question is also there. If anyone needs any more information, you can reach out to us. We'll meet again next week with another episode of Marvelous Medicine, which is going to be about how do doctors go about busting medical myths. So I hope you will all join us next week as well. Till then, thank you everyone once again, and good night.